Chapter 9, The Iris Anatomy, from Wolff's Anatomy 8th edition, page number 323, part 5. The vascular endothelium. The vascular endothelium of the human iris is not fenestrated like that of the vervet and rhesus monkey, the rabbit, pig, guinea pig, and cat. Fenestrations are present in the vascular endothelium of kittens, but not in rhesus monkeys as young as 6 months. In the fetal monkey, they are regularly found at the root of the iris. In the rat, both fenestrated and non-fenestrated vessels are observed. In the monkey, the endothelium is continuous and the intercellular clefts are closed to tracer molecules such as phosphatase peroxidase by Zonilla occludenti. Freeze fracture studies show that the endothelial cells of the iris vessels are joined by two types of intercellular junctions, zonilla tight junctions and gap junctions. Zonillae occludenti are represented by a complex network of anastomosing and branching strands that seal the intercellular cleft. They are preferentially associated with the outer leaf E face of the plasma membrane. The strands of the E face are in perfect register with complementary grooves on the P face. The numbers of strands vary from 1 to 8, over half consisting of 2 to 4. The degree of complexity of the junction represented by the number of strands and the frequency of branching is higher in these capillaries than in those of other tissues, such as dog, lung, or human placenta. The tight junctions between the endothelial lining cells of Schleim's canal are also less complex than the junctions of the iris vessels. Gap junctions are rare along the intercellular cleft. They are occasionally seen on freeze fracture within the tight junctional network as aggregates of closely packed particles on the P face, which are complemented by arrays of pits on the E face. No interendothelial junctions of venular type are encountered. The sparsely distributed intramembranous particles seen on freeze fracture within the junctional network probably represent simple intermediate junctions. Plasma-limal vesicles are encountered in freeze fracture replicas and are also found in other vascular endothelia. The cytoplasm of the endothelial cells is unremarkable except for the presence of occasional rod-shaped bodies resembling Weber pellet bodies and crystalline inclusions associated with a rough endoplasmic reticulum. These have also been reported in developing and adult ocular vessels of the macaque. They are increased in iridial vessels of patients with chronic simple glaucoma. The pericytes. The pericytes of the iris vessels are similar to those found elsewhere, including ocular vessels, such as in the retina. They exhibit a variable complement of filaments subjacent to the adluminal plasma membrane facing the lumen. An asymmetrical distribution of plasma-limal vesicles is concentrated at the abluminal surface as seen in the small vessels of the retina, corneal nimbus, and myocardium. The endothelial cells and associated pericytes are invested with a basal lamina approximately 0.5 to 3 micrometer wide. Outside this zone is a zone of sparse, longitudinally oriented collagen 7 micrometer wide, surrounded by a granular ground substance and a further connective tissue layer 10 micrometer wide. Larger capillaries have a more continuous layer of pericytes and a thicker basal lamina. In the monkey, the collagen sheet surrounding the adventitia, is composed of circularly arranged collagen fibrils 60 to 80 nanometer in diameter, separated from the adventitia by a variable space containing a sparse network of finer fibrils 20 to 30 nanometer in diameter. Vessels located in the more cellular parts of the stroma, for instance the anterior border layer, are invested in a thicker and more cellular adventitia. Nerves. The iris nerves are derived from the long and short ciliaries, which accompany the corresponding arteries which pierce the sclera around the optic nerve and run forwards between choroid and sclera to the ciliary plexus. Here, numerous branches arise, largely unmyelinated and showing many ganglioniform enlargements. Their fibers form plexuses A. In the anterior border layer, possibly sensory, B. Around the larger blood vessels, and C. Anterior to the dilator pupillae. They supply nerve filaments to all layers except the posterior pigmented epithelium. From the plexus of the dilator muscle, many non-myelinated fibers innervate muscle cells to endings which may contain synaptic vesicles and form close contacts 20 nanometer. The dilator muscle receives a sympathetic innervation and the sphincter muscle a parasympathetic innervation, but adrenergic and cholinergic innervation has been shown in both muscles. Some nerves supply uveal vessels and some the intrinsic muscles of the eye. They display many gangliform enlargements and are myelinated and non-myelinated. Nerve filaments form plexuses along larger blood vessels and are found in relation to all layers except the posterior pigmented epithelium. So the iris vessels, vascular endothelium of the iris is non-fenestrated and it has got the pericytes in between the basal lamina, two layers of the basal lamina on which the endothelial cells rest. Okay, that's it. And nerve supply of the iris in the stroma, it is derived from the long and short ciliary nerves, okay, which accompany the corresponding arteries. And they supply nerve filaments to all layers except posterior pigmented epithelium. Okay, now cellular elements of the stroma. Fibroblasts 1, second melanocytes, third is clump cell, and fourth is mast cell, I think. Yeah, fourth is mast cell. So four types of the iris stromal cells are fibroblast, mast cell, clump cell, and melanocyte. FMMC. Fibroblast, melanocyte, mast cell, and clump cell. Okay. So, cellular elements of the stroma. First, fibroblasts. The fibroblast, the most common stromal cell, is found around blood vessels, nerves and muscle tissue and throughout the iris substance. Where it is found? It is found around the blood vessels, nerves, muscle tissue throughout the iris substance. Melanocytes, with branching processes up to 100 micrometer long, form plexuses with each other and are arranged as cuffs around the basal adventitia. Their melanin granules up to 0.5 micrometer in diameter are round, oval, and in various stages of maturation. So melanocytes, these are branching, they have branching processes, they interconnect with each other, they form the plexuses with each other. These are arranged as cuffs around the tunica adventitia of the vessels. Then their melanin granule size is 0.5 micrometer in diameter and they are round, oval, and they are at various stages of the maturation. Their melanin granules are at various stages of the maturation. Now clump cells. Two types of the clump cells are found in the iris stroma. So clump cells are large round cells up to 100 micrometer wide, filled with inclusion granules and covered with fine villus processes. So they have the fine villus processes, clump cells, 1 to 2 micrometer long and 0.1 micrometer wide. They are found in the pupillary portion of the iris, especially around the sphincter. So these are especially found around the sphincter. The majority of clump cells type 1 are believed to be pigment-filled macrophages. These are pigment-filled macrophages type 1 clump cells. The granules are regarded as residual bodies containing mainly myelin granules. The large myelin granules in clump cells of the posterior stroma resemble those of the iris epithelium, from which they have been said to arise. So the large myelin granules in these clump cells of the posterior stroma, they resemble those of the iris epithelium, from which they have been said to arise. So clump cells type 1, they have the myelin granules, and they're said to be from the posterior pigmented epithelial cells. Now, smaller granules are found in clusters of clump cells in the anterior stroma and resemble melanocyte granules. These type 2 clump cells are surrounded by a basal lamina and are believed to be displaced neuroectoderm cells of similar origin to the iris sphincter. Clump cells are found in all irises, including blue and albinotic irises. Where they may be seen with slit lamp, their number increases with age. So clump cells. So these are 100 micrometer wide. These are large round cells. They have inclusion granules. They have the villi. So they are covered with the villous processes. These are 1 to 2 micrometer long and 0.1 micrometer wide. They are found in the pupillary portion, mostly in the iris, especially around the sphincter. The majority of the clump cells there are two types of the clump cells, type 1 and type 2. So type 1, they are believed to be pigment-filled macrophages. These clump cells are believed to be macrophages which are filled with the pigments, and their granules are regarded as residual bodies containing mainly myelin granules. The large myelin granules in clump cells of the posterior stroma resemble those of the iris epithelium, from which they have been said to arise. So these pigment-filled macrophages, the type 1 clump cells, they are said to arise from these posterior pigmented epithelial cells and present in the posterior stroma. And in the anterior stroma, the clump cells, these are of type 2, and they have the smaller granules and they resemble melanocyte granules. Clump cells are surrounded by a basal lamina and are believed to be displaced neuroectoderm cells of the similar origin to the iris sphincter. Clump cells are found in all irises, including blue and albinotic irises, where they may be seen with a slit lamp, and their number increases with age. Now, mast cells. Mast cells are found in the stroma. They are round, have villous processes, and contain characteristic dense amorphous or Swiss roll inclusions. So mast cells, these are found in the stroma, iris stroma. How their shape is round. They have the villous processes. Even these clump cells have the villous processes. And these mast cells, they contain the characteristic dense amorphous or Swiss roll inclusions. Now, clump cells also having inclusion bodies, and mast cells also having the Swiss roll inclusions. Okay, the inclusion bodies are Swiss roll, containing the dense amorphous material, while the clump cells having the granules, inclusion bodies in the granules. And depending upon the size of the granules and where they are found, they are divided into two types, type 1 and type 2. Type 1 posteriorly, type 1 anteriorly. Type 1 posteriorly said to arise from the posterior pigmented epithelial cells, and type 2 in the anterior stroma, they are said to arise from the melanocytes. So, extracellular matrix of stroma. Fibrils staining positively for type 6 collagen are found around the sphincter and dilated muscle fibers and extending into the nearby stroma. A strand of such fibrils connects the dilator at the iris root with the circular and reticular parts of the ciliary muscle, and also stains positive for type 4 collagen as well as for laminin and fibronectin. These strands may perform an anchoring function. There is intense staining for type 6 in the inner zone of the iris basal sheath, and elsewhere in the stroma, a fine fibrillar staining occurs, and there is endonuclear staining of the iris nerves. The disposition of laminin is similar, There is a strong reaction for type 4 collagen on the basement membranes, as usual, type 4 collagen in the basement membranes of the iris vessels, muscles, and the endothelium of the nerves. Fibronectin is present throughout the stroma, especially around the iris muscles. It is present in the basement membranes of the capillaries and along the internuria and is found in the outer parts of the iris vessel sheath. So extracellular matrix, obviously the extracellular matrix in any part is made up of the collagen tissue, elastic fibers, okay, and some cells in that. So we are talking about only extracellular matrix of the stroma. So it is mainly made up of the type 6 collagen, okay. And these are found around the sphincter and dilator muscles, while the connective tissue sheath with the basal lamina of the nerves and vessels is type 4, as found in other parts of the body also. The basal membrane is usually made up of the type 4 collagen. Okay, so it has got the type 4 collagen also, laminin and fibronectin also, and where they are found it is given in detail. I don't think it has got any clinical significance as such, so I'm not gonna repeat it again. So anterior epithelium and dilator muscle. I think I should cover this in another part. Okay, anterior epithelium dilator papillae will be covered in part 6. This is part 5. So these two things will be covered along with the posterior pigmented epithelium in part 6, and in part 7 I'll talk about the movement of the fluid and solute across the iris. So 2 more days and I'll finish the iris. Tomorrow I'll also talk about the gonioscopy because I'm bored of this anatomy part. I want to talk about some clinical part also, clinical stuff also. So along with the anatomy part, I'll make some short videos of the clinical stuff also in between, because I find anatomy a little boring without clinical part or applied anatomy associated with it. Okay. So heterochromia differential diagnosis also I'll be talking about later. But first, as I'm going to make videos about glaucoma, why I'm adding the iris anatomy, ciliary body anatomy and sclera, because their parts are associated with the anterior chamber angle anatomy. So I feel like covering the anatomy of these parts also at the same time, because then I don't read every mind. So, and it's good to read from the standard books. I'm really enjoying reading standard books, and you should also do the same. So tomorrow I'll be covering the anterior epithelium, dilator papillae and posterior pigmented epithelial cells, and the day after tomorrow the movement of the fluids and the solutes through the iris. Okay, and tomorrow I'll talk about the gonioscopy from the shells. So enough for today. Bye. No, I had to talk about the figures also. Sorry. Many figures, many figures. Okay, so there are many figures. So first figure is 9.32a. Transmission electron microscopy demonstrates that iris vessel endothelial cells are joined by tight junctions, paired arrows, and gap junctions. I stands for lumen. I. Where is I? There is L here. Anyways, so these arrows, these are indicating tight junctions and gap junctions. Okay, tight junctions, gap junctions. So I have already talked about the junctions. I think I should make a short video about the junctions also. What are zonula, tight junctions and adrenals and desmosomes and hemidesmosomes and gap junctions. Okay. So that also I'll cover later on. The tight junctions are present near the apices and lateral surfaces, adrenals and desmosomes, and hemidesmosomes between the cells and the basement membrane. Okay. So zonula, this term is for the strap or the band of zone that is attached or communicating with each other, and macula is when the point of the cell surface comes in contact with the point of the cell surface of the other cell. So that is about the macula, and macula adventitis is also called as dysmosum. Yeah, I'm very sure about it now because I confirmed it yesterday. Okay, so figure 9.32b. Freeze fracture electron micrograph demonstrates the typical network of branching and anastomosing strands of the tight junctions joining iris vascular endothelial cells. Okay, so this is the freeze fracture electron micrograph technology. The typical network of branching and anastomosing strands of the tight junctions joining iris vascular endothelial cells. Okay. So figure 9.33. A melanocyte and a fibroblast in the iris stroma. The melanocyte of the stroma have a more abundant cytoplasm than those of the anterior border layer. Obviously, the anterior border layer is very small, so the cytoplasm is going to be very small. And in the iris stroma, the melanocytes in the iris stroma, they are going to have abundant cytoplasm. It's logic. The two cells shown here are separated from each other by a narrow intercellular space. Okay, the two cells shown here are separated from each other by a narrow intercellular space, melanocyte and fibroblast. There is a narrow intercellular space here, A, shown as A. A cilium projects into the iris stroma from the cytoplasm of the melanocyte. So melanocyte has got the villi and cilia. So a cilium is projecting into the iris stroma from the cytoplasm of the melanocyte, and it is shown as B. Where is B? Okay, so there is a B. What is that? It is a cilium that is from the melanocyte projecting into the iris stroma. Okay. The melanocyte granules are completely melanized. Original magnification 13,200 times. Fine. Now, figure 9.34. Iris stromal melanocyte with mature melanosomes. Original magnification 37,500 times. What is this? Iris stromal melanocyte, because melanocytes are present in anterior border layer also in stroma. So this is the stromal melanocyte, and anterior border melanocyte having the scanty cytoplasm, and the stromal melanocyte having the abundant cytoplasm. So this is the stromal melanocyte with mature melanosomes. Okay. So figure 9.35. Numerous immature melanosomes asterisks interspersed with mature melanosomes and are present at the iris root. So immature melanosomes asterisks star interspersed with mature melanosomes M. Mature is M and immature are shown as star. So immature are faint colored and mature are very dark black colored melanosomes in the melanocyte. So that was about figure 9.35. Now figure 9.36. Bleached section of portion of iris to show clump cells. So clump cells, phagopupillae and posterior pigmented epithelium. So these clump cells are present around the pupillary margin abundantly, that is around the sphincter-pupillary muscle. So this is the bleached section of portion of iris to show clump cells. Depending upon the size of the granules and location, they are divided into type 1, type 2, type 1 posteriorly, type 1 anteriorly, type 1 having the larger granules, type 2 having the smaller granules. Figure 9.37. Transmission electron micrograph. A clump cell is seen near the iris sphincter. Note the numerous clusters of melanosomes. Okay. So clump cell is seen near the iris sphincter, as I have already said and mentioned that the clump cells are abundantly found around the pupillary margin, that is around the iris sphincter, and you can see numerous clusters of the melanosomes. That was about figure 9.37. The figure 9.38, how many figures are remaining? 1, 2, 3 figures are remaining. Figure 9.38, type 1 clump cell microphage in the pupillary region, original magnification 18,000 times. So You can see here type 1 clump cells. Clump cells are large, round, and depending upon the size of the granules, inclusion bodies are divided into type 1, type 2. And this is the type 1 clump cell, means large granules, and derived from, and it is like a macrophage. Figure 9.39. Iris stromal mast cell with myriad scroll-like cytoplasmic structures. The nucleus is indicated by N. Original magnification is 30,000 times. Okay. Iris stromal mast cell with myriad scroll-like cytoplasmic structures. The nucleus is indicated by N. Okay, this is the mast cell. It has got nucleus shown as N. Okay. Now, figure 9.40. A. Iris stromal mast cell. This type is less commonly found in the iris but is abundant in the limbus. So mast cell is less commonly found in the iris but abundantly seen in the limbus. This mast cell is distinguished by the fact that many of its granules contain cylindrical structures which are seen in longitudinal section A or in cross section B. So mast cell less abundantly seen in stroma, more abundantly seen at the limbus, and then they have these granules and cylindrical structures, long cylindrical structures. These are seen in the longitudinal section or in cross section. Longitudinal section A and cross section B. Okay, longitudinal, obviously you'll see the long, these black things, and these structures, and in cross section you will see the round black structures here. Obviously it's the cross section, that's it. A finely granular material is also contains C. A finely granular material in C. Where can I see C? Yeah, okay, I saw it. C, it is just below the B. Within the granules, original magnification 27,000 times. B, higher magnification to show the cylindrical structure within the membrane of the mast cell granules. They are uniformly dense and of equal length. So the cylindrical structures in the mast cell. Wow, very nice. In the figure B, they're having the similar length and uniformly dense. This is very nice. Then when I understand the figure fast, I feel very nice. Or anything, if I understand it and grasp it faster and clearer. Okay, now figure C, view of the cross sections of the cylindrical structures. Each cylinder contains an electron dense material, original magnification 90,000 times. The cross sections of the cylindrical structures. Each cylinder contains an electron dense material. Okay. Then D. Now these cylindrical structures in the mast cell, the cross section is shown in the C. So round things. Now the core material A and a mass of granular material B are found within the granules. Okay. In D, what they are showing, each cylinder contains an electron dense material. Oh wow. Okay. Now these cylindrical structures. Now each cylindrical structure, what they contain? They contain the electron dense material. Okay, the core material A, you can see the A, core material. At the core there is a material A and mass of granular material B. So these cylindrical structures having the core, having this core material A surrounded by a granular material B. That is shown in the figure T. Okay. Now what is this? Okay. So all the figures regarding these vascular endothelium, pericytes and iristromal cells, extracellular matrix of the stroma is over now. So I can conclude this part here. Tomorrow we'll see the anterior epithelium, dilated pupillary muscle and posterior pigmented epithelial cells of the iris. Thank you so much.